Good afternoon to all. Today's discussion is on borax. Okay. Industrially, it is used in glass as well as ceramic industries. Also, it's a component of insecticides and fertilizers. It can be seen in disinfectants or mouthwash, precursor in manufacture of boric acid. So, it's one of the important things that you need to remember is in the manufacture of boric acid. Again, boric acid is an antiseptic that is used. Okay, in world, major deposits of boron can be seen in Turkey, deserts of Turkey, and in India you have the valleys that you can see in Jammu and Kashmir can show borax deposits. Okay, common name is borate of sodium. This is the formula. I think this is not much important. In new method, it has a Treff strength of 1/10. What is this child showing? So there is a kind of fear or nervousness running through this remedy, and especially this is shown especially when you have fear of falling. Okay, so there is a fear of falling in this patient or a fear of downward motion in this patient. That is why this picture is put, and then you have this photo where the baby is trying to grasp the cradle. Okay, cradle or crib, where the baby is usually laid down to sleep. So again, there is this fear of going down. So the child actually tries to grab the handle or the handle of the crib. Okay. So dread of downward motion in nearly all complaints, great anxiety with great anxiety from downward motion when laying the child down in a couch or in the crib, cries and clings to the nurse. Okay, so who is going to keep the child? So child is actually feared of going down, so she or he tries to grab the nurse. Okay, clings to the nurse when rocking. So when you rock, this is your rocking motion, right? So when you rock, when you dance or swinging is another thing. I know I need not explain on these things, but yeah. So when rocking, dancing, swinging, all these things can have a backward motion or downward motion, which actually makes the patient nervous or afraid. Okay, going downstairs, going rapidly downhill, horseback riding. So all these activities have some element of this downward motion, which actually causes problem in this patient. Okay, you also have a comparison for Sanicular also. Okay, excessively nervous, easily frightened by slightest noise. So that is what I want you to remember. So there is a downward motion problem is also there, along with startled by slight noises. So somebody who just gets startled by very slight noises. I can say from my experience, I am a little easily startled. Even sometimes I have a very bad time when there's a festival season. A lot of crackers will be there, and when you ride your two-wheeler, then you have problems suddenly from I don't know from where all these things pops up. But yeah, I get startled. It's not that I will cause an accident, but yes, definitely I have that problem of startled easily. So I personally can relate that easily. Okay, excessively nervous, easily frightened by slightest noise or an unusually sharp sound, a cough, sneeze, cry, or lighting a match. So just see the level of nervousness. A cough, sneeze, cry, or lighting a match, and in that lighting a match is so so low sounded thing, and that can cause nervousness. Shows the heightened nervousness running in the borax. Okay, children awake suddenly, dreaming. Children awake suddenly, dreaming and graping sides of cradle without apparent cause. Other remedies being Epis, Sina, and Stramoni. Okay. Head you have something called as Plica polonica. The word is not exactly given here, but basically the head becomes frowsy, tangled, splits, sticks together at the tips. If these bunches are cut off, they form again, cannot be combed smooth. This can be seen very commonly in children, where I think maybe it's because of unhygiene, something like that. So yeah, the sticking of tips of the hair is usually seen in many children, and borax is one of the indicated remedy. But when you go a little more further, I don't know how far borax is seen constitutionally, but definitely sorainum, tuberculinum are leading remedies when you see for these kind of complaints. Okay, and you also have a indication in tuberculinum where sorainum and borax fails, tuberculinum acts well. Okay, so that's something that you need to remember. In eyes, eyelashes turned inward. Okay, so there is something called as entropion. So the eyelashes that is actually going outside turns inward and poke your eyes. So that's why that causes inflammation, conjunctivitis like that, and that's why it is written as tendency to wild hairs. Tendency to wild hairs, and because of all these things, there is going to be inflammation, and some kind of discharge will be coming from the eyes, causing agglutination in the morning. So agglutination in morning in conjunctivitis is a very common symptom. But eyelashes that turns inwards and causing inflammation, that is pretty uncommon. Okay. So tendency to wild hairs, you need to remember borax as the remedy. Okay. Nose is described as red noses of young women. Okay. Nostrils, crusty, inflamed tip of nose is shining red. Red noses of young women. Don't think of belladonna here. It is red noses of women is borax. Okay. Stoppage of right, or first right then left with constant blowing of nose, like ammonium carb, lacanine and magnesium. Okay, again ammonium carb has all your allergic rhinitis kind of symptoms, lacanine has shifting symptoms. Okay, in mouth, the most important indication clinically of borax comes in mouth because of aphthay. Okay, stomatitis, stomatitis where in mouth, tongue, inside of cheek, easily bleeding when eating or touched, prevents the child from nursing. Aphthay that prevents child from nursing with hot mouth, dryness and thirst. See, all the indications are there, which is very common in the clinical practice. Prevents child from nursing with hot mouth, dryness and thirst. Cracked and bleeding tongue, again comparison with anaptrophyllum. Salivation, especially during dentition. Okay, so these are your indications during dentition. You have aphthay, it can be salivation. Where is the aphthay? In the lips, or inside of the cheek, tongue, mouth. All these things are there with dryness as well as thirst. Okay, sore mouth, which is worse from touch, eating salty or sour food. We know if somebody has previously experienced aphthay, will understand what type of pain is that, and you can't even drink water also properly. So forget spicy food, these things. Water is kind of causing difficulties at times. Okay, and often from plate of the teeth. Remedy given here is alumen, not alumina. It is alumen. Okay. Yeah. In urinary system, you have the important symptom called as child screams before urine passes. Okay, frequent urination along with screams before urine is passed. The remedies are lycopodium, sanicula as well as sarsaparilla. Again, lycopodium, you have this red sand in urine. Sanicula is there, and also sarsaparilla for severe pain at the close of maturation, also with white sand in urine. Okay. In female, another important symptom is leukorrhea, as if warm water were flowing down. So that's another important thing. It is described as albuminous, starchy, okay, and it is profuse. Okay. From this albumin, I want you to remember egg. Okay, egg is there, egg albumin. So you have a description where it is mentioned as leucorrhea as if white of egg. Okay, so that is one thing that you need to remember. Other remedies are there like ammonium ure, alumina, calcirephos. Okay, so these remedies also come in the same bracket, leucorrhea as if white of an egg. Okay, so for that you have 4 remedies: ammonium ure, alumina, calcirephos, and borax. And borax keynote is leucorrhea albumina starchy as if warm water were flowing down. Okay, and for 2 weeks between the catamania. Okay, and the other remedies given is bovista and conium. Skin shows frequent suppuration, so it is unhealthy. Slight injuries separate like that of your hepar, Merxol, Silesia, Calendula, all those. I think graphitis also for an extent has the symptom. So any slight injury can cause separation, can be seen in borax also. Boric, you have a lot of indications other than these things. You have one important symptom that you need to remember is feeling of cobwebs, especially on hands. Okay, hands. Some remedy shows forehead, the cobweb on forehead. Some shows in hand. But generally, if you want to remember, you have 4-5 remedies. That is your borax, baryta, bromium. You have graphitis. These 4 things are there. I think in one of the in some remedy there is a mention for ranunculus scleratus, and also I think previously we have already discussed of alumina. Okay, yeah. Fear of thunder is there, so nervousness is already done. Violent fright from a report of gun even at a distance, so nervousness is handled already. Taste of cellar mold. Okay, I don't know how the symptom came, but whatever it is, there is this moldy taste or moldy expectoration that is mentioned in borax. Loose, pappy, offensive stools in children. So we have already seen bismuth, even in berberis also papicent stools, all this coming here. Okay. Yeah. Now, in nursing, while nursing the child, there is pain in opposite breast, leucorrhea like white of an egg, galactorrhea is there, membranous dysmenorrhea is there. Okay, and there is also a mention in Boric where there is sterility favors easy conception. So I think that can be taken as a note for clinical practice, especially in infertility. Okay, cannot sleep on account of heat, especially in head. Okay, so yeah, mild things, and you also have a pruritus pudenti local application. There is an indication in Boric. Okay. Going ahead, modalities, we know downward motion is already aggravation. Slight noises, smoking can bring diarrhea in this patient. Okay, so smoking can bring diarrhea. An important thing. Okay, smoking can bring diarrhea. Damp cold weather or before urinating. Again, before urination, the child screams. So that is also aggravation. Amelioration is by pressure and holding painful side with hand. Okay, pressure, amelioration is there as well as holding painful side with hand. It follows calcarea, sorinum, sanickel and sulfur. So all the major child remedies are covered, and it is followed well by ars, bry, lycopodium falls and silesia. Incompatible before or after acetic acid as well as vinegar and wine. Another important thing. Okay, acetic acid, vinegar and wine. It's not incompatible. Okay. Which remedy does not show plica polonica? We already mentioned these 3 remedies: borax, sorinum, and if borax and sorinum fails, tuberculinum can be given plica polonica. So out of the 4, I think Singamet should be the answer, which does not show plica polonica. Okay, that is your head, the hair getting glued, tangled, sticky at the ends, all those things. Okay, other remedies being Britacarb, Lyco, Sarsaparilla, and Vinca minor. Leucorrhea like white of an egg is seen in alumina, ammonium ure, borax, calcirephos. So all the 4 are there. So the answer is all of the above. Okay. So I think that's it. Thank you.